Well, good morning, and thank you, Kylie, and thank you to the Australian College of Nursing for inviting me to be here with you today. I have to say, I looked at the program and went, gee, thanks, Kylie. You put me in between two such entertaining and knowledgeable women. So I'll be the sandwich in the middle, maybe. So I would like to begin by acknowledging the traditional owners of the land on which we're meeting today, the Gadigal people of the Eora Nation, and I would also like to acknowledge elders past, present and future. And I pay my respects to Aboriginal and Torres Strait Islander people present here today. And I also need to extend a very warm welcome to Sydney. I'm sorry we haven't turned on the warm weather for you, it's been a bit chilly. So as Kylie said, I started in the role of Chief Nursing and Midwifery Officer for New South Wales just over 12 months ago, and it's been a very steep learning curve, but a fantastic role, and I'm very pleased that I'm actually in the seat at the moment. It remains a huge privilege for me to work with and lead nursing and midwifery in this state. And during the time that I've been getting acquainted with the role, I've had the opportunity of visiting health facilities and meeting face-to-face with many health professionals from Gosford to Griffith and from Mount Druitt to Mudgee. And for those of you who know me, I'm very geographically challenged, so I've done very well to find my way around. They've shared with me both the challenges and the passion that they have as nurses and the innovation they want to bring to their work. And my visits with staff and patients in the communities have confirmed the respect that I have for the work that nurses do each and every day. Today's nurses, as you'll all be aware, are at the forefront of modern healthcare delivery, whether it's in the context of providing care to our increasingly complex patients, undertaking and publishing research to inform the development of evidence, or actively addressing healthcare policy. Nurses contribute to service development and planning and manage and lead large and complex healthcare services. As nurses, we are pivotal in ensuring safe, person-centred, compassionate care. We work with and advocate for patients and their families and collaborate with colleagues across all disciplines. We work in increasingly complex environments, and the pace of technology that we're now facing is unprecedented. More and more aspects of how we provide and document care is becoming electronic. It's not just a matter of adapting to electronic records and medication administration, but as nurses we also need to be engaged and adept at using and interpreting the data that is available to us. And so we can be truly contemporary in our practice and contribute to our ability to improve patient care outcomes. Really, have we seen the complexity and the rate of change that we're now experiencing at both a societal level and in the way that we deliver healthcare? The thing that remains constant is that as nurses we are involved at every point of care, 24 hours a day. Sometimes the pace of change can be challenging. However, I am a firm believer that with every challenge there's always an opportunity. And to be truly effective, we need to be able to adapt. We need to, more than ever, to understand explicitly what it is to be a nurse and the values that we hold and the difference that we can all make because of those values. I was reading a post recently on one of the social media sites where a senior manager talked about the fact that his success was because of his values as a nurse, and it was those values that carried him through his senior management career. I'd also argue that those values are based on compassion, advocacy, being part of a team, and really wanting to make a real difference to those in our care. And I think many of us would be able to relate to those ideas because it is our values that anchor us, and it's our connections as human beings that underpin the reason why we turn up to work every day and why we are so well positioned to ensure that patients have better outcomes because of it. As I was preparing for today's session, I began to reflect on my own experiences of change and about my style of leadership and the values that I hold, and how that has actually influenced the way that I respond to and lead change. I began to recall an experience when I was a beginning nursing unit manager, a long time ago now, and I had only been in the role for a really short period of time. And I was asked to be part of the reconfiguration of ward specialties within the hospital. Services were being transferred from one hospital to another, and they were being consolidated. I'm sure you probably faced similar things in your career as well. I had to lead what felt to me at the time as a fairly substantial change, and it was about the configuration of the ward that I was managing. Not only did it mean a change to the clinical specialties within the unit, but it also meant that some of the staff would be moved to different areas to work, and the type of nursing that they would be working in would change. There were some very experienced nurses who were very passionate and held significant skills and knowledge about the specialty that they were working in. And they were now being asked to work in a smaller bed base with another specialty that they'd never worked in before. The inpatient part of their specialty had been shrinking, and for some time they had been anxious about what that was going to mean for them, not as only as individuals, but for patient care. So it was going to be a big challenge and a big change for them. And as part of this, I was trying to negotiate a change process that would provide them with an opportunity to transition into the new way of working, but also to provide opportunities for some of the more senior staff to work in different roles that aligned with the outpatient model of care that was being proposed. I guess was probably a little bit green about the overarching requirements that the organisation needed and why they were driving the timeframes that they were. But I do recall a somewhat challenging conversation with the then Director of Nursing, who I recall saying, just as we were finishing our conversation, "Jacqui, morale is all well and good, but I need to get that ward closed." I did pull it off though, so I was very pleased about that. I guess looking back, that was just a small example of the tension that I sometimes felt in my early management career between the transactional requirements of change, the necessity to get things done, with the opportunity for change to support new ways of working, and the leadership required to bring people along the journey. I recognised then the importance of engaging both the heart and the mind. There was a little time there where I did seriously question myself about whether I was the right fit for senior nursing positions, and so I took a bit of a left-hand turn, and I spent a number of years being involved in coaching and facilitating, and was really heavily involved in running some leadership programs. I wanted to be able to support nurses to develop clinical leadership skills, to enable them to actively participate in improving patient care and making sustained changes to clinical practice. I also wanted to contribute to how, as nurse leaders, we could hold the space with regard to our influence and participation in the delivery of quality patient care. For me, leadership has always been about developing relationships with people and understanding what motivates and drives people, not only for their own development, but for the greater good of the team and ultimately the patient. And I firmly believe that our strength comes from our collective wisdom. It's impossible for us to be good at everything all of the time, but there's always someone else who can bring a different skill set and a different perspective. And one of the most rewarding pieces of feedback that I've received in my career, as it often is, was part of a farewell speech, and I was leaving a role as a director of nursing, and one of the nursing unit managers was providing one of the speeches, and she spoke about the fact that I got to know the NUMs and the leaders in the hospital as individuals, and as such I was able to identify their strengths and what motivated them to contribute and to make change. And for me, it doesn't get much better than that. As I've become a little older, and I hope a little wiser, I've come to realise that just because we come at things a little differently, it doesn't mean that we're better or we have the right way of seeing things. It's just different. We need to learn to see things from each other's point of view so that we can influence and compromise and sometimes agree to see things differently. So I did eventually return to operational management roles, but prior to that, the career moves that I made provided me with an opportunity to be involved in leading the implementation of the Essentials of Care program across New South Wales, which Kylie's just briefly spoken about. And the program had been developed by another director of nursing that I work with here in Sydney, Anna Thornton, who I had the privilege of working with so many years ago. Her leadership allowed me to see that the impact of a shared collaborative approach to leadership and change. And I learnt what I think I'd known instinctively, that it provided a way of working where individuals and teams could flourish and most importantly, the experience of care for patients, families and carers could be enhanced because of it. I also need to acknowledge the then Chief Nursing and Midwifery Officer, Deborah Toms, for her absolute vision and courage. I can now appreciate that from where I'm sitting, in rolling a program like this across the state. Not only was it an enormous task because of the sheer size of the state, but it was also a piece of work that was challenging nurses to look at how they were delivering care, how we evaluated our practice, and what it meant to patient outcomes. And it also meant that we also needed to be prepared to change long-held beliefs and ways of seeing the world. It meant for some of us that we had to relinquish some of the established power and points of control so that we could enable other people to make change. And for nurses on the floor, it meant that we needed to examine our own values and practice and to realise that sometimes what we believe we're doing is different to what the patient experiences. We were engaging both the heart and the minds. The program is going to have its 10th year anniversary next year, which I think is remarkable. And it continues, as Kylie said, to be one of the main platforms of work that is led from our office. In a lot of ways, I think the program was ahead of its time. And if you think back 10 years, we were leading with a focus on building collaborative workplace cultures and putting the patient back at the centre of what we do. Our next challenge is to harness that potential and to strengthen and focus on identifying and implementing best practice at the local level. We need to be challenged to more fully use the clinical data that's available to identify where improvements can be made. And that was always been a fundamental aim of the program. I believe we now need to make it front and centre to align with the bigger system priority for safe quality care. And it's also about enabling nurses to be active in that space and to articulate the leadership and the focus it holds for our everyday work. I'm just seeing my time. I've got a little bit more time. So what have I learned from my participation in the process of implementing and embedding the program? First thing I think is never underestimate the unforeseen benefits to individuals and to professional growth. Part of this conference is about nurses finding their voice and advocating for the healthcare outcomes of our communities. I believe that one of the major successes of the program has been its strength in sharing and making the changes that nurses make to patient care explicit. Early on in the implementation of the program, I recall one of the then Deans of Nursing at one of our universities stating that the program provided nurses with the language to talk about and make explicit the difference that they make to patient care. And I believe one of the great successes of the program is that it has provided a platform for nurses to speak professionally and articulately about the practice changes that they have made. Since the beginning of the rollout of the program across the state, NAMO has hosted an annual showcase where participating nurses and teams come together to share their ideas and achievements and improvements in patient care. I'm pretty sure that I've been to every single one, and what I've seen over those years is an absolute growth in the confidence that we are able to present the work that's being undertaken. And it's become an absolute highlight for nurses and midwives in New South Wales, and we're now able to attract about 500 delegates a year. We've also seen new leaders emerge, and the program has provided opportunities, as I said, for individuals and teams to shine. We are now seeing a number of nurses who were identified as local leaders in the implementation of the program, and they're now taking on senior roles. The facilitation and the communication skills, as well as the leadership attributes that they have developed while supporting the program, have been enhanced, and they're now seen as clinical leaders and managers within the system. I'm aware that Essentials of Care is one program, and that there are many frameworks and programs that have similar aims. Ultimately, it is about how nurses embrace leadership frameworks for change, so we can engage meaningfully in one of what my colleagues refers to as contemporary nursing practice. We sometimes feel like we need to ask permission to make change. I encourage you and your teams to continue to actively engage in opportunities to improve services, to speak up when you think change is needed, to foster creative thinking, Inspire your teams to challenge the status quo and ask, where is the evidence that informs our practice? Or why we in fact need to do things differently. Be open to new ideas and ways of working. If one approach doesn't work, then we can always try something else. And most importantly, we need to share and be loud about the contribution that we all make. As the healthcare system evolves and the challenges and changes continue, nursing will continue to evolve. The heart and the values of the profession always stay the same. The role of the nurse as it remains caregiver and advocate for the most sick and vulnerable members of our communities. Compassionate care delivered with courage, commitment and skill is our highest priority. I'm immensely proud of our profession, the way in which we continue to strive to improve care experiences and outcomes, adapting our approach as needed to ensure that we do the very best in every situation. Events like this confirm that we are not alone in wanting to ensure that nurses are at the forefront of the health care reform agenda. We need to continue holding a seat at the table, helping to lead the way with informing and transforming our practice, remaining focused on person-centred care and ensuring that we have a workforce equipped to meet the demands of the future. Each and every nurse can influence and lead change. And together we need to harness our hearts and our minds to manage the challenges of today and to shape the opportunities that tomorrow will bring. So thank you.